submitted, and Tony said we're ready to go.
Okay, very good. Good afternoon, everyone. I'm Tom Stolz, County Manager, and we're going to provide every other day updates regarding vaccine distribution, at least for the next few weeks, while so many pieces of this are moving. So let me just kind of go through what happened yesterday, what's happening today, and what is happening tomorrow. So yesterday at our news site over at the library, the mega site, we gave 1,464 shots. 791 of those were for new client first shots, and 673 were people coming in to get their second shot. Today, on Wednesday, we had 1,445 appointments made. That's 823 appointments for first shot, new client first shot doses, and 622 second dose shots. And as of today, we still had a few appointments that were open for second shot people that may have filled by now. So these numbers are what we were looking at coming into this morning. Tomorrow, so far, we have 1,103 appointments scheduled, 504 for first shot dose, and 599 for second shot. We still have 108 appointments available for first shot and 249 available appointments for second shot. And just to recap, we are now operational at 223 South Main, which is the old Wichita Library. The city of Wichita was very gracious and worked with us to crack that facility open on Monday. And even yesterday, we were kind of acclimating to that, but I am hearing reviews that is working very well for the community. We still also are running drive-through operations at the Transit Center operations, 777 East Waterman. And the hours at the Transit Center are 9 to 6 for drive-through, and at the library address, the hours are 10 to 7. We got some calls yesterday that there was a line outside, and when we investigated that, it's because people are lining up well in advance of 10 o'clock. And whatever you could do, media, to put out that if you have an appointment made, you are guaranteed a shot. We have enough shots. There's no race. We're not going to run out. If you have an appointment made that day, there's no sense coming early and standing in line or showing up 2 hours early to an appointment. You will get a shot if you have an appointment that day. So if you would help us putting that message out, it will just help us logistically out there to run more smoothly. So to date, the way we set here on February 24th is we are giving shots to healthcare workers because they were part of phase 1. And remember, as we cycle through this, you're never left behind. So even if you're 75 or 77 years old and we've now moved to 70, you're never left behind. You can make an appointment and receive your shot. And as we move down in the near future here to 65 and above, if you're 70 years old, you're not being left behind. You can still make an appointment and get the shot. So we're still doing healthcare workers, and today it's 70 and above. As we have mentioned a couple times this week, we have pivoted this week and are aggressively vaccinating school teachers and staff K through 12. We have operational plans with each of them. We have received the vaccine, the extra vaccine that we were promised for each of them. So thus far this week, we've received 7,000 Pfizer doses. That actually should have been here last week, but because of the weather didn't make it. We have received those. We have also received our 7,000 Pfizer vaccines for this week. And we have received the 3,500 extra vaccines earmarked for teachers, Pfizer, that will be administered. And we also have been told that we're going to receive an extra 5,000 Moderna vaccines earmarked for teachers. We think those will be in on Thursday. So we are in great shape to get our K-12 teachers and staff vaccinated. Most of them here in week 1, and whatever is remaining, I'm confident we will get done in week 2. So, next week by Friday, 100%, or anybody that wanted a vaccine, let me put it that way, anyone that wanted a vaccine will have received one. And then, of course, we repeat that process in either 21 or 28 days, depending on if you got Moderna or Pfizer, and we'll go through it again, but we'll have vaccines guaranteed for that as well. So that's going well. I think that's the update. We have, this is the other thing I kind of want to talk about is the mega site, as we have talked about, will remain open. You know, I'm going to, at least to the 4th of July, I just can't envision that coming down anytime before then. But what's going to change in this community within the next few weeks is you will see pharmacy partners, and we have a list of them that we're working with. There's actually 80 pharmacy partners or partners within the community that want to help vaccinate. So you will see places like Kroger and Sam's Club and Walgreens and CVS. You will see those pharmacies begin to receive federal allocation of vaccines. And that will help greatly, and they will then help us vaccinate the community, staying within phase 2, you know, 65 and above, and all those occupational groups that are listed in phase 2. And it's probable actually, that if the county begins to receive more vaccine, which we have been told we will within a couple of weeks, that we will begin to transfer some of our vaccines to these pharmacies as well. We also have doctors' offices and clinics in queue ready to help us with this. As the vaccines begin to increase coming into the community, we are well positioned. We have a lot of throughput capacity in the community, and that will expedite this entire process. And then the last thing is we're hearing that Johnson & Johnson will be approved, and that's a single shot. So when we see that become approved and we begin to get that in the county, that will make this go faster. I didn't want anyone to be scared by the modeling that we did yesterday that shows that in some scenarios this thing goes till May of 2022. There is no way that's going to happen. I am hopeful that we can get enough vaccine to where those that want it will have it by early summer. And then I think our challenge is going to be trying to get members of our community interested in getting the vaccine, because everything we're hearing from the medical community is the more people that vaccinate, the more effective it is against the spread of the virus. So with that, I would be glad to answer any questions. And if not, we'll do it all again Friday at 3 o'clock. So.
All right, so we can go around. It looks like Cape News, you are top on my screen. So are there any questions from John or anyone from Cape?
Yeah, Tom, I was curious, the health department put out, I'm not sure if you would be aware of this, but the health department put out that they're in need of volunteers as this process continues. Do you see, once we start opening it to lower age groups, do you see that need going up as more and more people are added to this process? What is the county kind of plan?
Yeah, I think that what you're seeing operationally down at the library now is going to be very consistent with the future. We'll ramp that up to some degree. I was just talking to a person been down today, and actually I think we had 44 vaccinators down there today. So we had great help today. I think our plan moving forward, unless something drastic happens with the vaccine supply, that we'll always plan on doing between 1,500 and 2,000 vaccines there per day. So that, and of course you need volunteers other than vaccinators too. There's traffic control and helping people get in and out, and people that can observe after they've been given a shot. And that's, I think, what Adrian is looking for, the health department's looking for, is any kind of people that would want to help with that. And then I think what you're going to begin to see, the real strength of vaccinating the community is going to come through the community partners, the pharmacies and other facilities within the county who are ready and willing to help with vaccinations. And there could be, particularly if the county rolls a secondary site away from the mega center, that we might be looking for volunteers to run a smaller type of clinic and begin to target areas of the community where people are maybe having a hard time getting to the mega site. So I think that's what she's out soliciting. I don't know that we need it here and now, but we see a time in the future that we might need some more.
Okay.
I have a question. It's Anthony Maisel from CAIC. Do you see the age dropping from 70 to a lower age soon?
Yes.
When? What's the age?
I knew there'd be a follow-up to that. You know, I think we're targeting, and what we watch on that is we watch how fast our vaccine slots are filling. And as that begins to slow, then that's an indication that we need to open the aperture. You know, early next week is a guess. Sometime next week for sure, whether it's early in the week or late in the week, and that could change. I mean, if tomorrow we're having trouble filling appointments for Friday, Saturday, we'll react to that. So that's clearly the next step to go to, and there's a lot of things of beauty about that, because then it is all ages, all of our elderly ages are now can become vaccinated, scheduled to be vaccinated. It could backlog us a little bit, so people should be prepared that when we open that aperture, that their appointment may be a week or 10 days out, but they'll be able to schedule, get on the list. So the sooner we can do that, I think it sends a cleaner message to the community, 65 and above, and then we turn our focus as we prepare for the next phase of these the occupations that are now listed in phase 2, and we'll be visiting with Dr. Mins this week about prioritization of that, and that of course comes with a lot of controversy, and we know that. But Dr. Mins will give a recommendation to the Board of Health, and of course the Board of Health can accept it or ask questions or maybe even tweak it. But it will be, Dr. Mins' recommendation will be based on science and based on what he thinks is best for the community in regard to 3 things. Number 1, stopping death. That was priority. That's why we isolated on elderly people. Number 2, to stop serious hospital visits. The ICU numbers have come down considerably, and that was part of the strategy. And then the third thing was to stop the spread. So he will look at those population groups as far as, you know, at-risk people and who can we vaccinate to stop the spread most effectively. In other words, who has the most contacts out there with people, and then he will give a recommendation to the Board of Health.
May I ask a follow-up?
Sure.
Certainly, the media is not first responders by any means, but we're out there in very hot areas, and we take all the precautions we can. And I'm sure not only CAIC, but all the media outlets have experienced problems with staff members. Is there a possibility down the road that they would expedite the media who goes out and covers these areas, such as nursing homes and stuff, that they get vaccinated?
I just wrote it down. I will ask Dr. Mins when I visit with him and tell him that media is, of course, very interested in getting vaccinated. And we would ask that when you do get vaccinated, please cover it. Please show it to the audience that it's safe. But I will ask that question. I don't have the plan in front of me right now, the phase plan on where media falls into that. But I've made a note. We'll ask Dr. Mins about it, sir.
Thank you.
All right, and I do want to make sure that we recognize Commissioner or Chairman Pete Meitzner is also here for questions. Moving along, KWCH, Mike, do you have questions?
Just a couple of quick questions. Are the teacher vaccinations reflected on the dashboard?
You mean as far as the numbers of appointments?
The numbers, yeah.
No, we're independently handling those. All of the teacher vaccinations, all of them, are away from the mega site. So 259, for example, has their own, we actually just transferred to them. They're running vaccinations out of their administrative area. Each of the districts within the county have their own kind of individual plan. Some are going directly to pharmacies and getting vaccines, and some are forming what we call partner pods. And those are at various locations, which the county will help run those, but those numbers are not reflected in the appointments and the amount of vaccination we're doing today. That's at the mega site. The numbers, however, are reflected in the vaccines that we receive. We are counting that as total vaccinations. We'll figure out a way, we'll count probably, once the vaccinations for teachers start, we'll probably throw that and we'll put an asterisk by that so that you know how many teachers were vaccinated in comparison to the general public getting shots at the mega center. That's a good question, and we'll factor that in before the weekend. I think Mays might be actually getting shots today, but most of the school shots will be happening Friday and Saturday this week, and then Friday and Saturday again next week as well.
And then just a quick follow-up on the additional vaccines. The state admitted that the urban areas were getting fewer vaccines than rural, and they're going to correct that. You mentioned we are getting more vaccines, yet it looks like we're not giving any more this week. How much do you expect to pick up the pace, and how many more vaccines are you expecting to get here in the next couple of weeks?
We're hoping that as the state sees more allocation, that it'll increase the counties. And there's two things I think that help Johnson and Sedgwick. First of all, the state has recognized that the rural counties are actually ahead of us in phase vaccinations. And so I think they are already talking about a strategy where maybe now some of the smaller counties, they'll go to every other week, or they'll factor in some type of logic there so that we will begin to receive more. And then if the state as a whole receives more vaccines, which is what we're hearing from CDC, then that will also help us. We're hoping, I'm hoping we have double. We get 7,000 on Monday now, and then we get another 7,000 on Thursday or Friday, which are earmarked for second shots, booster shots. We're hoping that number will go to 12, 14,000 within just a few weeks, which allows us to work through that model much faster than what we had displayed yesterday.
I have a question as well. This is Anna from Channel 12. Tom, can you talk a little bit about demographics? How many in this 70 and older range do we have? And what does the 65 group look like? And how many people might that be?
Yeah. In the 70 above, 70 to 74, we showed, I'm sorry. Oh, I'm sorry. I was told my camera's off. Hold on. Let me see if I can fix my camera. How did that happen? Okay, back. In the 70 to 74 age group, we had 18,000 roughly. And we've been on 70 to 74 group now for probably a little over a week. When we open that aperture to 65 to 70, we anticipate that's going to be another 25,000 population. And let me qualify this. That's what would be 100% of the population. The reality of what we're seeing is there's a fraction of that, 70 or 80, 90% of the community will want it, but we have a potential of another 25,000 when we go to age 65 and 70.
I also saw that on, I think it was Monday, that there were only about 200 first doses given out. What was the reason for that? I mean, I see multiple appointments open. Is it that we moved to a new site, or what was the issue there?
It was, we did not start vaccinating till 2 p.m. on Friday because we had to use the morning to get recalibrated from Interest Bank Arena over to the library. So Monday was, that's why you're seeing the low numbers on Monday. And even to some degree, yesterday was still kind of an acclimation day. You'll see that number ramp up now. And we're hoping to, try to keep it right around 1,500. Particularly while we're serving our elderly population. And as we start to see more vaccine come in and we're beginning to serve other population groups, we're hoping that number will even go up as well. If we're seeing, we do have appointments for tomorrow. The document I'm looking at, but this is a few hours old, we had 108 first dose appointments yesterday, or for tomorrow, still open, and 249 second shot appointments still open. So whatever you can do to market that, have people check the website or call the phone number. And we'll try to, we want to get those full clearly so we can keep this moving. Another phenomena we're seeing with second shots is, there's a lot of national debate about second shots, that do we even need them? And the answer is right now, yes, CDC is still recommending, KDHE is still recommending second shot. And does it have to be right on the 21st or the 28th day? No, but we're trying to get that done within a 4 or 5 day window. I think the human nature being what it is, I think we'll see that some people maybe won't show up for their second shots. And at some point, we will reallocate that vaccine and put it into an arm of a first dose and go again. We're having strategy sessions on how to manage that right now. Is there if you wait so long, are we going to move on with your second dose? But we'll put that out to you all. We'll be very transparent about that. But for right now, we're still holding second doses for those that are due.
And this is Sean Logging with KWCH. I have a quick question either for Tom or Pete. In addition to vaccines, we're seeing COVID-19 trends in Sedgwick County drastically down from where they were last month or even a few months ago. Just kind of what does that mean as a county? And are you talking with Dr. Mins about maybe easing some of the restriction in the health order currently in place?
I'll go first, Sean, and then let Chairman clean up whatever mess I make. Yeah, we're definitely watching the numbers, and we watch the rolling 14-day average percentage of infection rate. We watch how many people are going to the extension center for testing and just global testing within the county, because there's many locations you can test now using the MDL, the molecular diagnostic lab at WSU. There are many companies that are testing. So we keep an eye on that. We visit with the hospitals every Monday and hear about their patient count and their ICU counts. And then we also now are keeping one eyeball on how many people in the community get vaccinated. First shot, and then what we call fully vaccinated, which is the 2 shots. And as that number goes up, and if the number continues of infection rate continues to go down, and our testing numbers seem to keep going down, which they are, that sends a clear message, I think, to Dr. Mins that he will revisit. Now, the order that we currently have is in effect until sometime in March. We will talk with Dr. Mins on Friday about a number of things, but one of them is going to be what his feelings are on regulation right now. And I would be, he will definitely want to discuss it. I know he watches it very carefully, and he will make a decision as soon as Friday if that needs to be modified. And of course, we'll let you know if that happens.
Sean, I'd just add that's what you're seeing in the community is another. To me, it's a great community effort to, for the most part, abide by and respect the health order, the spacing, the restaurants, the capacity, obviously the masking. We've made great progress with the school systems. The what's it called, Tom? High and low. Oh,
on the quarantine. Yeah, quarantine. High risk, low risk.
High risk and low
risk.
You
helped write that. I just want to make sure you hadn't forgotten.
But that high risk, low risk, and that was based on schools that had been open in the fall and kind of were keeping track of their own data about how they were sending home these kids that eventually come into this low risk area, and they'd send them home for 10, 12 days. They'd come back and not one of them were sick. And so we're learning more all the time. And what you indicated, that all those signs are pointing better for us to, again, responsibly keep opening up, either all of them together a little bit more or individually. One of the things, maybe it's gathering first, maybe it's strongly urging on masking, whatever. I'm just amazed that if I could just compare, Wichita State, we've had basketball games canceled, not because of Wichita State team, but because SMU in Dallas, Memphis in Memphis, Cincinnati. So that it tells me, these college, and it's not Manhattan and Lawrence canceling. So some of these communities apparently are not managing their spread as well as what we are locally here and maybe in our state. So I'm encouraged, but I don't want to overpromise that we can't find something that goes backwards. But boy, having all these vaccines coming in now and being ready, having Spirit and Textron ready to step in when they're eligible to kind of vaccine their own employees, I mean, it's all pointing in the right way.
Tom, last question for me. Have any vaccines ever gone unused?
I think we lost pretty early in the game back in phase one. I think we lost a dose, one single. And that was some type of spoilage issue. But since then, no, and we're almost hypersensitive to that right now. And that's part of, as we reach out to community partners, and particularly when we begin to send them county vaccines, that's just part of the deal. Don't waste a single dose. Have always somebody, and at the end of the day, the most vaccine you should have available for any type of wait list is just a handful, 1, 2, 3, 4, no more than 6, because you get 6 doses out of each vial. So give the vaccine to somebody. Grab if you're in a pharmacy, grab a customer and say, hey, do you want the vaccine, and give it to them, even if it's outside of the phase area. Don't waste a single one. And we've been running that way at the mega site. I think we've said before that we have a list of public safety people, police officers, sheriff, corrections, and police officers from actually all around the county, Valley Center and Hayesville, that we have their name on a list. And if we end up with 3 or 4 or 5 at the end of the day, we call them in off the street, or we call them in and we give them a vaccine, so that we waste not a single dose.
Thank you.
Sean, Alex, do either of you have questions for Tom or the chairman?
I'm good. Thank you.
All right. Okay. I know we also have Debbie Looper here from Congressman Estes's office, and there is a note in the chat for you. There's a constituent who is 68 years and 7 months and not allowed to make her appointment this week, even though there are the multiple openings. So are there any provisions for folks with special health concerns?
Not yet, but soon to come. One of the things that Dr. Mins has been chewing on for a 3 weeks now is ways to handle individuals who are highly at risk. If they get the virus, they would be very sick or perhaps die. So he's been trying to figure out a logical way to manage that through physicians' offices within the city and within the county. So on this particular constituent, that's 68. When we go down to 65 here in the near future, they'll get their vaccine that way. But a better question would be, what if you had a 62-year-old, same situation? That's part of the discussion we'll be having with Dr. Mins, and I know he has some ideas on how to manage that. And we will, again, we'll roll that to the Board of Health, and we will keep you aware when we come up with new policy on that. That is even CDC has kind of pivoted on that a little bit. They are actually listed 16 to 64-year-olds who have health conditions are actually in phase 3. And I remember reading this a month or so ago, I'm thinking that doesn't make a lot of sense. And even CDC now is verbally saying that maybe we should look at taking care of those people who have high risk. And Dr. Mins has been on that for 3 or 4 weeks. We've had several commissioners, several members of the Board of Health from the bench have articulated that ought to be a priority. So we'll come up with a strategy very soon to take care of people who are in that high risk category, and we will roll that out.
All right, Kirk, do you have any questions?
Yeah, Tom, you mentioned, you talked a little bit about coordination guidelines with pharmacies and community partners. Can you talk about some other guidelines that you, and the coordination of how easy or difficult it is to get pharmacies together as you're ready to go with them?
Well, first of all, what we're determining right now is, because mostly what we're seeing coming is Pfizer, so you have to have the super phrase capacity to store Pfizer, not necessarily to administrate it, but to store it. And some pharmacies have the ability to do that and some do not. So we're trying to determine who has it, who doesn't. Other than that, from a regulation perspective, they're under the same guideline, whether they get vaccine from from federal directly or from the county. We all want to stay within the phased plan. So we're all on the same page. They offered, many of our partners offered that if we would give them county vaccine beforehand, they would abide by whatever the county policy at that time was regarding age or what group we were giving shots to. So they've been very easy to work with. They have tremendous capacity. We've all gotten flu shots there before. They're very good at this. So other than that, when they receive federal vaccines, it is theirs. We in the county see no reason to, I mean, they can give the shot to whoever they want, to be honest with you. When they receive county vaccines, we'll want them to stick with if it's 65 and above, or if it's people with health conditions, or if it's aircraft workers or police officers or whatever group we're working, we'll want them to stay consistent and offer positions and appointments for those people to get vaccinated. It's been very easy to answer the question. They're very good partners.
Are you concerned that, you know, you could have a situation where people are talking, hey, the Walgreens at Central and Hillside is vaccinating anybody? Is that a concern at all?
Well, yes and no, Kirk. I guess it is, because we want to keep an order and a public health perspective on managing the virus. But no, to some degree, we're all going to have to get back. We all should get vaccinated. Everybody on this call, no matter how old we are or what we're doing. So as long as somebody's getting the vaccine, I don't stress too much about it. And we all know, we talked about this in the commission meeting last week, there's going to be anomalies. You're talking about the vaccination of 400,000 people with 2 shots, so that's 800,000 shots. You're going to get an anomaly. Somebody's going to slip in. Some 62-year-old's going to get in there and get a vaccine when it should be 65 and above. And we try to limit that. We try to, communicate well and give good policy. But at the end of the day, as long as somebody's getting vaccinated in the community, that's a good thing for all of us.
Thanks.
All right, and KSN, are there any questions for Tom or the chairman? Not hearing any. Are there any other final questions that we need to come back and get some responses for?
Hey, thanks to all of you for what you're doing. So many of you are doing a great job of helping us with this. The more information we can get out, the better. We'll try to be very clear in our messaging. If we're ever confusing to you, please let us know, because if you're feeling it, other people will as well. So just thanks again to all the news media for what you've done, not just with vaccinating here, but this whole COVID adventure, how you have helped the county put our message out. So just appreciate you all very much.
Thank you, Tom. Thank you, everyone.
This is Pete. I agree. Thank you all for covering this. I pay attention to it, and you all are doing a really good job. Especially, I think you all understand how rapidly the information changes. So I think that's why Tom and we encourage to say, let's do a Monday, Wednesday, Friday, because it's changing rapidly. And fortunately, it's been changing for the positive right now. Let's hope it stays that way. Thank you.
See y'all.
Thanks, everyone.